everybody, and welcome to Includes podcast presented by Proximal Solutions. Before we go into our episode today, there is something that I really need to share with you guys, because if you don't know, you need to know. So if you have not heard about Anchor, guys, it is the easiest way to make a podcast. And I said it is the easiest way because number one, it is free. Yes, it is free. There are also creation tools that are going to allow you to record and edit your podcast right from your phone or your computer. It does not get any easier than that. But wait, there is more. Anchor is also going to distribute your podcast for you so that it can be heard on Spotify, Apple Podcasts, and more. You can even make money from your podcast with no minimum listenership. It is everything really that you need to make a podcast, and it is all in one place. So do me a favor, go in, download the free Anchor app, or go to anchor.fm to get started. Hello everyone, and welcome once again to another episode of Includes Podcast presented by Proximal Solutions. I am your host, Marlegny Mourino, and I am so thrilled to be here with you today. And we're going to discuss coronavirus. I know it's a hot topic, and I've been preparing for this episode, everyone, because it's just so much that is going on. And every day I would get together and I'm like, oh my God, okay, I'm going to do it today. But then guidelines will change. There was more discovery. There was more information. So I know I'm a little bit late to what's going on, but I still wanted to come on here to talk to you guys a little bit about coronavirus, some background and some more information that I have, a little bit about coding, and also how is everyone dealing with this quarantine? Okay, I know it's a little bit different for everybody. I had a conversation with one of my students last week, and she's like, I am about to lose my mind. So I also want to talk about the quarantine, talk about some of the things that we can do during this time. So let's start with first things first. Let's talk about coronavirus, okay? So coronaviruses are named for the crown-like spikes on their surface. There are four main subgroupings of coronaviruses known as alpha, beta, gamma, and delta. Why is this information important? I think it's important because I've heard so many people say, you know, this particular cleaner says that it kills coronavirus, so it must be something that has been around for a long time. So understanding the subgroupings and also understanding that the first human coronavirus or human coronaviruses were first identified in the mid-1960s. That's why you're seeing that information on the cleaner. So the 7 coronaviruses that can infect people are the first 4, the common human coronaviruses. So we have 2 alphas and 2 beta. So remember, there are 4 main subgroupings: alpha, beta, gamma, and delta. So the common human coronaviruses, the first 2 are alpha. We have 229E. We also have NL63. Then the next 2 are beta coronavirus. The first one is OC43, and the second one is HKU, and then the number 1. The other human coronaviruses, we have MERS-CoV. This is also a beta coronavirus. This one causes the Middle East respiratory syndrome that we also known as MERS or MERS. The next one is SARS-CoV. This is another beta coronavirus that causes severe acute respiratory syndromes or SARS. Then this last one is SARS-CoV-2. This is the one that causes the novel coronavirus that causes the coronavirus disease 2019 or COVID-19 for what we call it for short. So a diagnosis with coronavirus 229E, NL63, OC43, or HKU1, those are the first 4 that I mentioned, is not the same as a diagnosis of the COVID-19, okay? COVID-19 caused an outbreak of respiratory illnesses, and it was first identified in China back in 2019. So you might be wondering, you probably already know this information, how does the virus spread, right? So the virus is spread through mainly person to person between people who are in close contact with each other within about 6 feet. That's why if you have gone to the grocery stores lately, you see that even at the registers, they have, like some kind of tape representing 6 feet away so that people are not standing so close to each other, okay? Through respiratory droplets that are produced when an infected person coughs, sneezes, or talks. These droplets can land into the mouth or nose of people who are nearby, or possibly be even inhaled into the lungs, okay? Some recent studies have also suggested that COVID-19 may be spread by people who are not even showing symptoms. So you might be a carrier, but not have no symptoms, okay? Some of the symptoms include fever, cough, shortness of breath. They also may appear from 2 to 14 days after the exposure. And this is based on the incubation period for other coronaviruses like MERS, okay? So how can you protect yourself and others? Real simple, and I know you probably have heard this information, but it's so important. I wanted to make sure that I reiterate some of those things. So the first one is to clean your hands often. So make sure that you're washing your hands with soap and water for at least 20 seconds, especially if you have been in public places, or even after blowing your nose or coughing or sneezing. Okay, so very important. If soap and water are not available, using hand sanitizer that contains at least 60% of alcohol, please and thank you. Make sure that you cover all surfaces of your hands and rub them together until they feel dry. And make sure that you're avoiding touching your eyes, your nose, and mouth when you have not washed your hands. And I know sometimes it's so you just do it. You just touch your eyes and you touch your nose, and you're not even thinking. But please try to avoid touching your eyes, your nose, and your mouth when you have not washed your hands. Another tip will be to avoid close contact. This is why, we're saying stay at home as much as possible. Stay at home, stay at home, stay at home, okay? Avoid close contact with people who are sick. Make sure that you're putting a distance between yourself and other people, as I mentioned earlier, about 6 feet. Make sure to also cover your mouth and nose, with, it could be a face cloth, when you are around older people, okay? Remember that you can spread it even if you're not feeling sick, and other people can spread it even if they don't feel sick, okay? Make sure that if you're coughing or you're sneezing that you're covering yourself, okay? If you're in a private setting and do not have your own cloth covering, remember to always cover your mouth and nose, okay? Make sure that you throw those used tissues in the trash. Please don't just throw them outside, or, if you're wearing gloves, then just take them off and throw them in the parking lot. Make sure that you clean and disinfect frequently for, the surfaces that you're touching all the time, like tablets, tables, doorknobs, light switches, countertops, phones. Guys, our phones. I mean, we grab our keys, grab our phones. Our phone goes with those everywhere, okay? So make sure that you're cleaning and disinfecting everything that you are touching. So when it comes to coding for coronavirus, effective February 20th of this year, 2020, we had specific guidance that was developed by the CDC and the 4 approved organizations that make up the cooperating parties. Okay, so the cooperating parties are the National Centers for Health Statistics, the American Health Information Management Association, the American Hospital Association, and also the Centers for Medicare and Medicaid Services. So they developed one of our first coding guidance, again, back in February 20th of this year. So they gave us very specific examples, which I'm going to go over with you guys today. So the first example is we have a pneumonia case confirmed as due to COVID-19, okay? So we are going to assign code J12.89, this is other viral pneumonia, and B9729 for other coronavirus as the cause of disease classified elsewhere. So that's the first example. The next example, we have acute bronchitis for a patient with acute for a patient with acute bronchitis confirmed as due to COVID-19. So we are going to assign codes J20.0, this is acute bronchitis due to other specified organisms, and B97.29 for other coronavirus as the cause of diseases classified elsewhere. Now, bronchitis not otherwise specified, or NOS, due to COVID-19 should be coded using J40. Bronchitis that is not specified as acute or chronic, also along with code B9729, which is, again, other coronavirus as the cause of the disease classified elsewhere. Okay, so that was the second example. The next example we have is for lower respiratory infection. So if the COVID-19 is documented as being associated with the lower respiratory infection, not otherwise specified, or NOS, or an acute respiratory infection, NOS, this should be assigned with code J22. Unspecified acute lower respiratory infection with code B9729 for other coronavirus as the cause of the disease classified elsewhere. If the COVID-19 is documented as being associated with a respiratory infection, not otherwise specified, it would be appropriate to assign J98.8. This is other specified respiratory disorders, also with code B97.29. So for cases with acute respiratory distress syndrome due to COVID-19 should be assigned the code J80, okay? And also B97.29. Exposure to COVID-19. So for cases where there is a concern about a possible exposure to COVID-19, this is ruled out after the evaluation. It will be appropriate to assign code Z03.818, encounter for observation for suspected exposure to other biological agents ruled out. For cases where there is an actual exposure to someone who is confirmed to have COVID-19, it would be appropriate to assign code Z20.828. And I've had to stop and just kind of say the numbers one by one to make sure that I get the numbers correct. This is for contact with and suspected exposure to other viral communicable diseases. Now, when you have patients that are presenting with any of the signs and symptoms such as fever, cough, or shortness of breath, and where a definitive diagnosis has not been established, we need to make sure that we're assigning the appropriate code that represents that sign and symptom. So, for example, if it's the cough, we have R05. If it's shortness of breath, then it would be R06.02, or unspecified fever, R50.9, okay? If the provider, though, documents suspected, possible, or probable COVID-19, do not assign code B97.29. Assign a code explaining the reason for the encounter, such as fever, etc. Okay? Now, on March 11th, 2020, the COVID-19 was declared as a pandemic by who? The World Health Organization. On March 13, 2020, a national emergency was declared in the United States concerning the COVID-19 outbreak. So, given those developments and the urgent need to capture the reporting for this condition, on March 18th, a new guidance was announced from the CDC of a new diagnosis code, and the code is U, the letter U, 07.1. And this is for COVID-19 to be used from October 1st of 2020 to April 1st, 2020. So these are some of the guidance that is out there. Like I said, one of the things that is really big right now has been also telehealth. So the biggest takeaway that I want you guys to have from this information is, if you're coding, make sure that you have the most updated information. So maybe by the time you're listening to this information, to this episode of this podcast, maybe this information has been already obsolete. So always, always, always verify, make sure you have the most updated information. Don Self, D-O-N Self, I followed him on Facebook. That's one of the platforms that I follow him. And he recently posted that he was creating a separate page just because of the developments that are constantly happening with COVID-19, some of the payers and some of the things that you can do. He has a page that he dedicated solely for this. So one of the things that I'm going to do today and that you're going to be able to see is when you look at the description of this episode, I'm going to go ahead and list on there all of my resources. So a lot of my resources that are coming from the CDC, CMS, and the World Health Organization. Okay. So that way you want to have the most updated information. You can see exactly where I got my information from, and you can see that those are reliable resources. But I also urge you guys to confirm that this information is still correct, that no other changes have been made, and that no other codes are out there, and now we have to code things differently. So make sure that you're reviewing that information anytime that you're coding any of these visits. Okay. So the other thing that I wanted to talk to you about is about staying sane during this quarantine. So I've been working from home for a long time, and I've been blessed to be able to still be working up and running and up and working every day. But I know that that's not the same for everyone. So, some of my colleagues are just now transitioning from being in the office to going to work from home. So it has been a transition for you. And some of my colleagues are also dealing with having, they have the kids are home, and now we're having to also homeschool. So it's all about staying sane during this time, and reaching out if you need help. That's also okay. But I think the biggest thing that I tell everybody, okay, we need to look at this, the positive. Okay, everybody's like, oh my God, I'm stuck at home. Well, you're safe at home. Now you have the time to do so many other things. Okay. We need to look at this and say, okay, this is my new normal. Okay, accept it. This is the new normal, and make sure that you are either creating a routine. If this is the first time that you've been at home, working from home, or homeschooling, create a routine. Or keep a routine. Sometimes I see I don't have to get up at 5 a.m. because I don't have to drive an hour to work. So I'm gonna, not wake up so early. So now the time that you would spend in the morning getting ready and getting some of those things done, it's gone. So it's very important that we create a routine, that we keep a routine, that we make a schedule. So one of the things that I personally like to do is on Sunday, I said, okay, what are the tasks that I need to complete? And I said, okay, I'm going to do this on Monday, I'm going to do this on Tuesday, and so on and so forth, because, I'm dealing with several different things at the same time. So creating a schedule works for me. Does not work for everybody, but if you are at least able to break up your day into sections, okay, during the first half of the morning, this is what I'm going to concentrate on. The second half of the afternoon, this is what I'm going to do. That's going to help you in pretty much staying sane, and it's going to make sure that you are fighting boredom. When you plan things out, you won't get bored so easily because, okay, I got to get this done, I got to get that done. But one of the things that I'm going to caution you is to avoid burnout, okay? Because now you're home, you're like, I can get this done, I can get that done, I can get this done, and I can fix this, and I can do this. You don't want to do that either, because it's like you're gonna get burned out. You're gonna be working all day, every day, and then you're gonna run out of things to do. Is the second takeaway from that. So make sure that you are not burning yourself out. Fight boredom. So a lot of people to fight being bored, they might, watch TV, but this might be a time where you want to limit your news intake, only because there is so much going on in the world, and not always we have good things being highlighted in the news. We're not hearing about, the over 10,000 cases of people that have recovered from COVID-19. We hear there are more cases, this is going on, that's going on. So we might want to go ahead and limit our news intake, because, we don't want to be in a state of panic 24/7. We can also take a technology break, guys. We are constantly on our phones. So maybe saying, what, I'm just going to do social media at specific times. I'm not going to be on my phone all the time. that's also going to be good, especially if you're, keeping a routine, making a schedule, and being able to take that technology break. Now, on the other hand, you also want to stay connected to other people. So, I mean, it's kind of hard. Like, okay, I'm telling you to take a technology break, and then I'm telling you make sure that you're staying connected. It's all about finding that delicate balance, okay? You want to stay connected. You want to, reach out to your family, check up on them, and see how they're doing. Feed the positivity off of each other. Okay, have a couple of friends maybe that you can say, hey, check up on them every other day, see how they're doing it, and continue to motivate each other. Okay, now I've also told people during this time is the time where you can say, okay, what are the things that I've been wanting to do for so long, either at home, okay, or for you, do you want to learn a new language? This would be a perfect time. Do you want to take a course? There's so many courses out there. Like, I love edx.org. You can they have all kinds of courses in there from reputable universities. So, go in there, create a profile. It's free, and it's called edx.org. Listen to podcasts. Perfect example. And maybe, listen to TED Talks, maybe cook a little bit more, with the kids. Get the kids, okay, guys, let's learn how to make this particular dish today, and keep the kids engaged. I've seen where some parents are actually taking like the chores and putting it like as part of their learning, like the school learning and the things that they have to do for school, like integrate chores so that, they're busy, you're busy, and you're working together. House is clean, things are getting done, and the work is also getting done too at the same time. So you want to make sure that, again, you stay busy, but you want to also avoid burnout and also fight boredom, because a lot of the times when we're bored, some of us eat, some of us sleep when we're bored, we binge watch movies or TV, which, if you do that once or twice, that's fine. That's perfectly fine. I've done it. I've spent an entire day while I'm like, you know what? I'm not doing anything today. I'm disconnecting. I'm just going to pick up a book and read, or I'm disconnecting. I'm just going to watch, a marathon, I don't know, on The Matrix movies, and do something like that. You can also, do puzzles. I mean, there's just so much that you can do. Make sure that you're taking care of yourself, okay? Make sure that you are being easy on yourself, because this is a time where you don't want to put any more added stress on you, okay? So make sure that you are focusing on the positive, and also make sure that you're taking it one day at a time, okay? Yes, I talked about making a schedule and different things like that, but take it day by day. Do one thing at a time. If you had to eat an elephant, I say this all the time, how would you eat an elephant? And people tell me, well, why would I? So I tell them, if you had to eat an elephant, how would you eat it? How would you eat it? And the answer is one bite at a time, okay? So although this might be our new normal for now, this is not going to be a forever now. So let's stay positive. Let's focus on those positive things. Let's continue to spread that positivity. Be easy on yourself. Take care of yourself. And also, let's make sure that we're taking it one day at a time. So these are my suggestions on staying sane and how I stay sane, because now I'm home too. So I'm home 100% of the time. I don't get to go to the office once or twice a week anymore. And also for me has been finding that delicate balance between, okay, I'm starting at this time, I am ending at this time. That has been my biggest struggle. So if you're working from home, either you're used to doing it or you are brand new working from home, make sure that you have a schedule for yourself. Like, you have your start time and you keep your lunch time. It's very important that you stay active. So for example, I have a 2-bedroom home, not a 2-bedroom, a 2-story home, and I actually go downstairs. I get water. If I need to, go use the restroom, I go downstairs. I don't use the one upstairs, because that helps me in moving. Body motion stays in motion. So make sure that you're taking your breaks, make sure that you're staying active. So I don't know, take some time to exercise. You can look at exercise videos on YouTube. There's a lot of videos right now of people, working out at home with even no equipment. So that's something that you can look into, incorporate their kids in some of these activities too. They'll enjoy it. It might be good for 1 or 2 days. They might get bored after that. So it's like, okay, what are we going to do next? The next big thing. So guys, it's a very hard time. It's a very stressful time for a lot of us. And we have to find ways to, again, stay positive and make sure that we are not adding more stress than what we need to. So make sure that you're taking care of yourself, and also make sure to take it one day at a time. All right, so this is all I have for you today. Thank you all so much for tuning in and listening to me one more time. If you have not listened to my other episodes, please do so. If you have any questions, if you need any help, remember, I said to you guys, this is a partnership, okay? You're sending me questions. I'm making sure that I am answering those questions through my episodes, but I want this to be a partnership. I want that when I get here and I start recording and I create an episode, this is the things that you want to listen to. So send me a message, send me an email, leave me a comment, follow, and do all of those wonderful things that we can do nowadays with social media. But most of all, please stay safe, and I will catch you in the next episode. Thank you. Have a blessed day.